Little Falls, Minnesota. This small town, located on the banks of the Mississippi River, is a picturesque scene with the winter snow and the Christmas decorations. This small town charm and hometown feel is the perfect place to raise a family. For Chris and Elizabeth Badling, that was just the idea. Unfortunately, the beauty and splendor of this town is not one that Elizabeth will enjoy very often.
I'm Elizabeth Fadling. I'm 31 years old, um, and I have Lyme disease and co-infections. Um, I was bitten by a tick um, on a family vacation with my dad and my brother in Pennsylvania when I was 5 years old. I got like dizzy, couldn't, and when I say dizzy, I'm not talking just like a little bit of dizzy. I'm talking couldn't stand up, couldn't sit up. I would just fall over, couldn't crawl, couldn't do anything. I was vomiting. I was drenched in sweat. Um, and just this, it felt like I was in one of those like fun houses. I couldn't, and it wouldn't stop. I mean, it was days of this. Chris brought me into the ER, and of course, they always ask you what medications you're on. And because I'd just gotten off of the doxycycline a couple of days earlier, I said, I reminded him I just, finished up doxycycline, and he said, well, what was the doxycycline for? And I said, Lyme disease. And he said, well, that's what's wrong with you. 2 weeks of doxycycline is not going to cure Lyme disease. That's what's wrong with you. You need to find a doctor who's going to treat you. And I was furious. I just thought he was being lazy. I mean, I was livid. I'm sitting here going, I'm miserable. I'm barfing my guts out here. I've been like this for days. I'm drenched in sweat. I can't even sit up. And I mean, I feel awful. This is, 2 days of this. This is ridiculous. And there's nothing he can do for me. He's just being lazy. He doesn't want to do his job. And so, we left the hospital, and a couple days later ended up going to the emergency room again because it wasn't, I mean, I'm still the same. And they said, well, maybe it's Meniere's syndrome, or some kind of like a crystal thing imbalance in your ear or something, and eventually it'll find its place back and you'll be fine. So I was like this for 2 weeks. Couldn't couldn't crawl, couldn't sit up, couldn't do anything, and just sweating and vomiting. And so the thyroid thing, all of these things are going on, and I had Bell's palsy again. I woke up with the Bell's palsy, and I thought, this is not okay. I mean, I'm getting really scared here. Everything is going wrong. There's things that nobody can explain. Um, I wonder if that doctor was right. Let me look up Lyme disease and just see Lyme disease and thyroid is what I typed in, I think. And the report that I had read that this doctor had written sounded like me. I mean, it was like the story of my life. And so I brought it into my family doctor and said, you know, this Bell's palsy, everything, I mean, the juvenile rheumatoid arthritis, all of this, and the fact that, I mean, I remember, my dad remembers when I was bitten by the tick, I've had a bullseye rash, I've tested positive for Lyme disease. Isn't it worth I mean, if you've had it for this long, I've been on antibiotics for strep throat, different things, you know, is it possible? And of course, we weren't talking about the co-infections, at that point. Well, this is my medicine fridge. It's got meds in it, and I'll show you that. And this is where, when these needles come out, they have to go in a sharps container. So that's what this is, and what is. And then I've got in here, this is a different kind of needle that goes in my port. There's a few different kinds. There's another different kind. These are, this is a dressing. I can't use this covering, but there's two masks in here, one for my nurse, one for me. Sterile gloves, a couple pairs of sterile gloves. Um, And then these in the white are flushing syringes. I need 2 of these to take my medication. And then in the yellow, these are heparin flushes. So these are supposed to keep, once I'm done infusing my medication and I flush the line with saline, then I push the heparin, and that's supposed to keep it, or help keep it from clotting, so I don't get like a blood clot. And then I'll show you inside the med fridge. This is different medications, like the VSL. This is what I need right now. There's lots of different kinds of medications in here and different IV meds. This is an injection, and these are an IV. So it's just a medication that I push through myself. These are injections. Sorry, they're hard to get open. My husband usually. These are just more another injection. And then there's like suppositories. Some of them are suppositories. Some are pills. Of course, there's a lot of pills that don't need to be in the refrigerator and stuff. But that is what my med fridge looks like. Super fun stuff. Everybody wants one. I couldn't name or even come close to hundreds, if not thousands of, I've been on more medications. When I was in first grade, I was on medications all the time, and ever since then, I've been on, medications. Sadly, until I was diagnosed with Lyme disease, it was wrong medications and just kind of, experimenting to see what would help and what wouldn't.
Chris and Elizabeth had been married for 5 years. Although Elizabeth was sick when they first met, nothing could prepare this couple for the battle with Lyme disease.
He doesn't really have time. He was on work, and, it's late at night, and Paige and I are in bed, and he's got to get things done. And then, he's up, late trying to get things done around the house, and then Paige is up early, and he's trying to take care of me, trying to take care of Paige, trying to get everything squared away. He's trying to get shopping done, house. He literally is doing everything. And not only just everything, but caring for 2 sick people. That's a lot of work. He might as well have 10 kids. It's, trying to keep my medication straight and my doctor's appointments and, phone calls and Paige's stuff and get her, to where she needs to be. And, doctor's appointments. It's too much for one person. We don't really have time. I can't remember the last time my husband even sat down and read the paper or sat down and watched television for 5 minutes. He just doesn't have time to be normal, so not really. Even our conversations happen as he's coming and going and trying to take care of me and take care of the house. And we just don't have, he just doesn't have the time.
Paige was born August 25th, 2007.
Congenital Lyme disease is different than what I got from a tick. Congenital Lyme disease, her body developed in the womb sick, not normal. There's not a single cell in her body that isn't sick. Things usually don't turn out so well for those kids, and I don't want that for my daughter. I've been through the heartache of losing a child, and obviously I don't want to lose her, but at the same time I don't want to see her not live a normal life. I want to see her like a normal kid. I want to see her go to school. I want to see her graduate from high school, go to college, get a good job, have kids of her own someday. That probably will not, if unless they come up with an actual cure for Lyme disease, she probably isn't going to have kids. I mean, it's just not an option. But hopefully by that time, you know, there will be better options than just these drugs. And oh well, we'll hope that you go into what we call remission, but you'll still pass Lyme disease on. You know, I want better for her.
Paige experienced her first operation at only 5 weeks of age. Now at 3 years old, Paige's experience with doctor's office, nursing staff, and home health care has become a routine part of her daily life. On this day, Paige is feeling good and plays like a normal 3-year-old. Looking at her, you would never be able to tell that she has Lyme disease as she plays on the slide located in her living room. Thankfully, when Paige does feel well, she's able to participate in many of the same activities that a child without Lyme disease experiences. Unfortunately for Paige, when she is sick with Lyme disease, this is what her poor body looks like.
My prayers at night are thank you prayers. I mean, I say thank you. I say thank you for my husband. I say thank you for my daughter. I say thank you, you know, for the roof over our head for now. And and then the rest of it is very desperate prayers. Please God, don't take my daughter from me. Please God, let me get better. I can't do this anymore. Please God, don't let her get worse. Just let her get better. Or fine, let me be sick forever, but not her. I'll trade easily. You know, it's got to give, and it's been hard enough. I think I've paid my dues, and let's move on. Let's get to the good part. So I guess I have to believe that there there's a good part there for me. Most people are healthy when they're young, and then they grow old and they get sick, and the good part is in the beginning. Well, for me, I'm hoping that the good part is in the end. I'm waiting for my good part, and I hope I get there. I think determination counts for a lot, but it's not everything. I can't do it on my own. Obviously, I need the medication and the doctors and a little help from, something a lot greater than me.